I'm Matt Vogl, and I'm with the University of Colorado, and I run a center called the National Mental Health Innovation Center. The whole idea at the Innovation Center is, to accelerate the pace at which we bring new ideas into the field of mental health, because mental health has been very slow to change, slower than most areas of medicine, and the system is broken, and we just don't have the capacity to be able to treat all the patients. So we work in areas like prevention. We do a lot of professional education at the university level, so things like how do we get dentists to better understand mental health and what their role is in helping to deal with the anxiety that their patients might be feeling, or how do business leaders who are getting an MBA understand what they can do as future business leaders to be able to run an effective business and take care of the mental health needs of their workforce while also improving their bottom line. We do work with schools. We're working with Pixar Animation Studios to build social emotional learning curriculum using the movie Inside Out as a backdrop. And then we do a lot of work in technology. Technology is another area where mental health has long lagged behind the rest of medicine, even though there's a lot that tech can bring to the field in terms of making care more widely available, to give us brand new tools that we haven't been able to use before in treatment, and to be able to use in prevention. Today at the symposium, I was talking about virtual reality, and virtual reality is a technology that has incredible uses in all areas of healthcare and treating physical conditions, and also with mental health. And because of its broad mental health and training uses, a lot has been developed for emergency preparedness types of training platforms, treating PTSD, helping workers get prepared to go into high stress environments. So there's a lot of different ways. And today I was talking about kind of the state of the field, what we know from research, how do you separate fact from hype, and where we think the field of virtual reality is going. Our center, we got our initial 5 years of funding through a grant, and then we rely on grant funding and philanthropic funding. But we also work with a lot of tech companies, large ones, like HTC, or some of the Google divisions, to smaller startups, and they pay us to help them develop content and to do validation studies so that we know if the mental health platforms that they're creating are working well. And then to help them develop training so that when they create a new platform using virtual reality, we're able to train the providers for how do you use that. So we develop that training for them. There's so many different use cases for virtual reality, and as a result then there's really an incredibly diverse number of professions for whom it's appropriate. So right now we're working in environments where we're using virtual reality with outpatient mental health providers, inpatient providers, primary care docs and nurses, dentists, police and fire departments, dispatchers. We're using it in schools, both K-12 schools and at the university level. And we've recently started doing work with the Department of Corrections in Colorado and in Alaska, using it with prisoners and with corrections officers. What we're seeing in China, they're a little bit ahead of us in using virtual reality in education, but virtual reality has really become kind of the next step in the evolution of the blackboard. That schools used to teach all their students using lessons on a chalkboard, and then eventually that evolved to overhead projectors and dry erase boards and then smart boards, and now you see entire classrooms where all the kids will put on a virtual reality headset and they can gather around a 3D virtual image, whether they're learning anatomy or something related to math or science, and they can engage and look at those 3D models. They can all move around it. Even if a kid is out sick, they can participate as though that they were in the classroom that day and participate with their peers. And it's much more sophisticated learning because you can if you're learning about the human body, you can make something larger, you can pull it apart, you can peel off the skin or get down to the skeletal system, and really infinite ways of learning about something using virtual reality. We, at our center, we really kind of stumbled into VR, and we met a guy named Walter Greenleaf, who was a professor at Stanford and has done some of the pioneering work. He's really one of the fathers of the field of VR, and has done a lot of the research. We tried out virtual reality in his lab, and we were so impressed and saw so much potential in using it for mental health that on the spot we offered him a job. And he accepted because he said, Stanford, he was just focusing on research, and he really wanted to be able to focus on how do you take what's been done in research and implement it in real world environments, which is what our center does. So he still lives in Palo Alto, but he works for us in Denver and advises us, and he's helped us really understand the field and what the opportunities are, and where we can really have an impact for for what we're going to spend. People try VR for the first time, it can be an incredibly powerful experience for people. VR is so effective at tricking your brain into thinking that it's in a different environment, doing something different, that very often it will produce reactions that are so strong that it can actually trigger physiological reactions. So for example, today we were showing people what we call the plank experience, which is where we take them to the top of a skyscraper, and then the elevator doors open and there's a plank that goes 500 feet above the street. And what we saw today is consistent with what we see all the time, where people immediately their heart rates shoot up, or they start to sweat, or their knees shake, and it's basically what it's doing is triggering fight or flight, because your brain says, I know that I'm on the floor of a hotel, but what I'm seeing is something unsafe, and so I'm going to go with that. I'm going to go with what I'm seeing and throw everything I can at the person to convince them not to get out of the elevator. So that's why you see the heart rates go up. So very often it's an incredibly powerful experience for people who are trying it the first time. One of the great things about virtual reality is that you can customize it to create almost any scenario that you might want to build. So whether that's building a meditation environment where somebody's sitting on the beach, or building a virtual job simulation that we're using with prisoners who are going to get released soon, whatever you can conceive, we can build in virtual reality. It's one of the reasons that we partner with so many tech companies, is because that way we can get them to develop things for us, and we go to them and say, here's an idea. We think that you would be able to sell this. There's a commercial gap that it's filling, and then get them to build it, and we'll help them validate it. Virtual reality is not unlike a lot of technology, where every 6 months we see a new round of equipment come out that is much, much better than the previous version, and in most cases is then less expensive, which is exactly the trend that you want to see, and that's what is going to drive more widespread adoption of VR. Some of the equipment that is coming out in 2019 I think is going to be game-changing in terms of really increasing widespread adoption. And those are what we call all-in-one headsets. So headsets that have the computer and the sensors and everything built into one headset. That gives you tremendous functionality to be able to interact with an environment, to use for education, training, gaming, whatever you might want. But you don't have cords to trip over, you don't have an expensive computer to buy. So we're going to see that trend continue in 2019 and I think beyond. One of the big hardships with getting people to really take virtual reality seriously is that it started out as primarily as a gaming platform and used for entertainment. And so up until last year, the #1 selling virtual reality platform in the United States was the Sony PlayStation. Obviously just something that was developed for gaming. And so then you try to get patients or doctors, professionals in other fields to take that seriously as a medical device or as a treatment platform. That becomes a harder sell. So people, it's like telling somebody that an Xbox could be effective at helping them learn surgery. So we have to overcome some of those perceptions about VR as just an entertainment platform. With respect to screen time and usage with virtual reality, it's an area of legitimate concern because the reality is we don't know what's a safe amount of time to spend in a virtual reality headset, both in terms of what it might be doing to your eyes by having a screen that close, or what it can do, especially with kids in a developing brain. So we at our center advise people to err on the side of caution. We know that even 10 minutes in a virtual environment can be enough to produce really profound and sustained impacts on behavior change or attitude change. And so we like to tell people keep it to 10 minutes or less just to be on the safe side. And we also suggest that we don't use this for ages under 13 until we have more data, until we really know what the impact is on the developing brain. Where we get really concerned is parents that might buy a virtual reality setup for their kids and just let them play it for hours on end. That's very, very concerning for us. There is a clinic in Denver, a primary care practice, where providers who are in these high stress environments because they have to see another patient every 15 minutes and they go nonstop and they really finish the day with an awful lot of stress. We've started using virtual reality with them so that they can take 2 minutes in between patients, put on a headset, and just meditate on a beach or somewhere beautiful. And we've been collecting data, and the first round of data has shown that it is incredibly effective at helping to reduce the stress that those providers feel. Hospitals are, one of the biggest cost drivers for hospitals is nurse burnout and turnover, and so we're using it with nurses to see if we can. Anything that we might be able to do that can show that we have an impact on reducing nurse burnout will be huge. There's a lot of data showing that like medical errors increase in the afternoons. As people get more tired, you probably heard studies that say if you're going to get a colonoscopy, always get one in the morning, because they tend to find twice as many polyps before lunch as they do after lunch, because they just get fatigued and tired and they miss stuff. And so if VR can be helpful at helping people keep their performance high throughout the day, then you can actually increase patient safety and reduce errors. There's been a number of studies showing that even a small amount of VR can have a significant impact on behavior change. One study that they did at Stanford, where they took 2 groups of people and each group read a passage in a book about the impact of deforestation on the environment. One group of those people, in addition to reading, they had go into a virtual environment and use chainsaws to cut down trees for 10 minutes. And then they tracked the paper usage of those 2 groups over 2 weeks. And after 2 weeks, the group that had spent 10 minutes cutting down trees with the chainsaws, they used 20% less paper. So it's kind of amazing that even a small amount of VR can have a sustained impact like that. Another interesting study that they used with VR was looking at how effective it might be at building empathy. And so they had 2 groups of participants. One group, they sat in a chair and just said, we're going to give you a helicopter tour, and they flew them around a city for 10 minutes. The other group, they said there was a natural disaster in the city and they had to evacuate. Except one baby got left behind, and you're a superhero, and that person could fly around the city looking for the baby. And after 10 minutes, they found the baby, and they flew out. The baby was safe. And then at the end of the experiment, the participants would walk out one at a time, and then they accidentally knocked over the table that had all of the supplies and the pens and the paper on it. And the people who had done were in the superhero group were twice as likely to stop and help, because they had even in just 10 minutes, it had put them in that helping mindset of being a superhero.